Much for joining us. So I think as we know that the COP28 is coming up in December, first week of December, which is the biggest the forum for the climate change, to raise the issue of the climate change and to get the and high level commitments by the countries is there, so that the action plans or the whatever the outcome is, that can be taken seriously by the governments. So this is this conference of parties is, I think it's the 28th session. So we can see that it is like doing a lot, and this is the main focus of it is with the climate finance. Loss and damage was the last year's focus, and the climate health system resilience is the coming up very it has gained very quickly the attraction, because the climate crisis is basically the health crisis. So so this seminar is it's very timely. I must say that the STPI has organized, and this the outcome of this, we are expecting that the key takeaways from this will be how we can enhance our participation towards this at COP28, as well as our how can we communicate with the government, so that their commitments which was done previously, how can we expedite that that process. So just to have an overview of this climate system health climate change and health system resilience, let me just have just to make it the conversation directed, so I made small presentation, so that this is the from press. It is the climate change IPCC reports. It's code red for humanity. Humanity means that is the health is one of the major major concern of the humanity. And the climate change is widespread, rapid, and intensifying. So this was the COP27 report, and this showed that how much it is important to look after the health of the populations. And so there is an increasing evidence that the health is directly and indirectly affected by the climate change. And a few of these recommendations of this IPCC report was that the climate-related illnesses are increasing, and there is a number of premature deaths are increasing, and malnutrition is increasing in all its forms, and its threats to the mental health and well-being are increasing. Mental health, climate anxiety is increasing in the everywhere, and climate hazards are increasingly contributing to growing number of adverse health outcomes, like communicable diseases and non-communicable diseases. Both are increasing, and in multiple geographical areas, and on one side they are increasing, and on the other side the response to these diseases is becoming difficult because of the climate effect on the health facilities. A significant increase in the ill health and premature deaths from climate sensitive diseases and conditions is projected due to the climate change. So these are all evidence-based statements by the IPCC, and they have the strong evidence, and the climate change is projected, and then why timely, proactive, effective adaptation. Many risks for the human health and the well-being could be reduced, and some potentially avoided. So this is the most important thing why we are here, and we how the health system can be proactive. So these are the four main hazards which are categorized by the, for example, the extreme rising temperatures, and more extreme weathers, and rising sea levels, and the increased carbon monoxide levels. So these are the main climate events which are affecting on the due to the air pollution, due to changes, and which ultimately results in the different disease patterns. So these are the almost all of them are direct effect, and some are indirect effects. For example, asthma and cardiovascular diseases. The air pollution is the main they are increasing because of this air pollution, increasing air pollution. And then the change in the vector ecology is like the malaria, dengue, encephalitis, Rift Valley fever, and different type of these fevers which are by vector, which are transmitted by the vector. And then there is increased incidence of allergies, respiratory allergies, and asthma. And it is anticipated that due to the water quality impact because of these climate events, like last year, the floods affected badly the water quality in those areas. So these are cholera, cryptococcus, and many of the other waterborne diseases can be. And the other is the water and food supply impacts, like the water, because of the water, the crops are affected. So the food security is impacted, as well as the water food supply is also impacted, and also the socioeconomic status. That is the broader aspect, but it is like they are affected. So that increases the malnutrition and diarrheal diseases also. And because of these environmental degradation, there is increased migration and civil conflict and mental health impacts. That there was a research that looked after these climate migration linked to the mental health, and there was increased percentage of the climate anxiety in those people. And heat-related illness and deaths are this is all a known fact, and there is increased injuries, fatalities due to this severe weathers, like during the rainfall, there is increase in the injuries. And health system impacts and vulnerabilities are the examples are I think there is on one side there are impacts, but on the other side there is like what are the effects on the health system. There is increasing demand for the healthcare services because of the impacts, and there is disruption in healthcare delivery, which further enhance the which makes the health system more vulnerable. And then exacerbating existing health inequalities, like for example, the health system or the health facilities in Islamabad are different from the rural areas or the flood affected areas. And increasing the burden of disease and novel disease emergence, which is and then impacting the health workforce, which is the most important. Workforce is affected because by the climate change. At the same time, they have to respond to the climate change events, and they have to maintain to work for the health of the population. So they are affecting, they themselves are affected, and their effect is further affecting the human. And the rising health system costs. Like obviously when if during the emergency the costs is increased, and how to the procurement to supplies and everything is increased. And this is like this slide is like why timely and proactive and effective response or adaptation is the answer to these questions. So the climate resilience is like it is anticipated. It is respond and to cope with the recover from the adapt to the climate related shocks. This is the climate resilient health system. This is the WHO definition, and how we can cope with the stresses, and how early we can revert back to the normal. So these are the and this is like the 10 components of the health system, which are broader component of the health system, which are which needs to be made resilient, and which have the broader impacts if they are not being made resilient. But the mainly are the governance, or the, like for example in our NCOs during the COVID-19, we saw that the governance and the leadership role was played by the national government, and so NCOC was there, so we responded well. Then health workforce, And then is health information system is very important, because for any intervention we need to have proper data. And then is that procurement and the technology, and also the health products, the medicines, vaccines, and these are mostly affected. And then is financing. Health financing is very, very important. And health service delivery system, that means the health care facilities and the human resource people working there, and their access. And also the community workers, they are also affected, because our MNCH program is dependent on the community workers. So what is vulnerability and adaptation is, vulnerability is the degree to which the individuals and systems are susceptible to the shocks, climate shocks. And the adaptation is the process by which the individuals and societies prepare for and cope with an uncertain future. And there are two types, that anticipatory and the responsive. So we usually are responsive we go for the responsive adaptation whenever we have the floods or any incidents. So we respond to that, like for example heat waves in Karachi also. So the what is vulnerability is actually the interplay of these three factors, like vulnerability factors like demographic, geographical, socioeconomic, social, and also the and socio-political, like what is the commitment of the government. And then is the hazards, type of hazards, what type of hazards we have, and also the health system capacity to respond to that. So this is the assessment diagram issued by the IPCC. So it's an iterative process, so that we can just hazard, vulnerability, and exposure, and the risk is there in the center. So so this is the diagram which shows that it's an iterative process. So you just make the decision, you have to consult this. And globally, if we look at this, so vulnerability assessment, vulnerability and adaptation assessment is the main area where we need to work on, because this is the factor. When we will have the vulnerability assessment in Pakistan, and then we can suggest some intervention, or then Pakistan can have some intervention which will make the health system resilience. So we will national adaptation plan is there, but we will come later on that. And 51% of the surveyed countries, it was a survey which was 95 countries participated in that, and only the 51% of the countries have done the vulnerability and adaptation assessment. And the 17% are on, and Pakistan, if we can see on the map, the Pakistan is not there. So then, and this is also the same, they have the action plan. 52% of the countries have the action plans. So the Pakistan in flood 22, it was a climate and health system response was like the health system was badly affected. About 40 billion the financial loss was there, and also the 13% of the health facilities were damaged, and 1/5 of them was completely damaged. So this was in flood affected areas, and the health system response was like we will ask about that, but what was the health system response on that. And what good thing was that there was a national emergency coordination emergency operation committee, and so the things were managed in a better way, as we learned from the COVID-19. And there were some institutional arrangements, but this is also a question to be asked from the panelists. And the human resource capacity was NIH I think there were some human resource capacity building activities going on and still going on, but to what extent we don't know yet. But we have invited someone from NIH, so we will ask from them also. And so this was all from my side, and now I would like to start with Dr. Zafar. Dr. Zafar Fatmi is the professor of community medicine and environmental sciences, and he's head of department, and his work on the air pollution and on climate change in health, climate change in Karachi is very is well recognized. And Dr. Zafar, my question is what do you, Karachi is also facing the climate change impacts, like the increasing heat, and heat waves are there. So how is your health system in Karachi, how does hospitals or how the health institutions, they are responding to this movement? Obviously we have the responsive adaptation, but are we having some new plans to combat this, or to make our system better?
So thank you, Dr. Razia. I hope you can hear me. And thank you for inviting me for this
Loud and
discussion. Okay, great. So, before going into actually what is happening.
Sorry, Dr. Zafar, to interrupt you. Please, can you please, I think he should, थोड़ा सा पीछे अगर आप हो जाएं तो आपका, हाँ जी, please, thank you.
You can't see me. Yeah, these are camera issues, sorry. So, before going into how the system is responding, and you wisely, I think, presented this to set the stage. As you said, there are impacts of climate change, and the health system is the first line of defense against climate change. And that is recognized globally, that health system is the first line of defense. And these direct and indirect impacts actually does more or less, just exacerbate the existing conditions. So if you have diarrhea, there'll be more diarrhea. If you have dengue and malaria, there'll be more dengue and malaria, and widespread malaria and all of that. So what it means, the system which is organized already have the capacity, or should have the capacity, to respond to most of the challenges, except for the emerging diseases and new diseases which might also be there, which will be added. So the burden is just enhanced in all respects, including communicable, non-communicable diseases and everything. You also spoke about 42 countries or 50 countries have adaptation plan in place. So we have signed policies. I think the adaptation plan was in discussion. Whether that adaptation plan has been approved or submitted to the IPCC, I'm not sure. Sorry, I can't hear you. You're saying something.
Approved and released by the government. Now Pakistan has a plan.
Now they have a plan. So
yeah, we have the plan. Yeah,
that's a great news actually, because all about adaptation. Preach to few of the people that, there is a heat wave coming, and then you have to be prepared for more water and more shade and more, you have to remain indoor. But I think that's a very weak response. That's a very weak response, and that has been happening for quite some time. I think we need to have, which is missing, we need to have all the stakeholders, especially in terms of Karachi or any city, the private sector, not just public sector. So private sector is not included at all in this whole discussion, and 90% in cities like Karachi is taken care by the private sector. There's hardly any public sector presence in Karachi. So when you disseminate these kind of information of alert, even it doesn't reach out to all the different hospitals of the private sector. So how do we, and heat island effect is about the city, it's an urban issue. And most of the urban is taken care by the private sector, and that private sector is not in the adaptation plan or in the alert and response system. So how do we expect that there will be a concerted response against either for the heat or for that matter, if the urban flooding happens? So that is, I think, is missing at the moment, and we need to do something about it. So I'll just stop here. Thank you.
Thank you, Dr. Zafar, about this. I think heat wave is like on the one hand, the heat wave is increasing heat is impacting, making the climate change, and on the other side, our hospitals are not prepared for that. Like on one side, for keeping the cool, the heat wave effect of the heat wave on the population is there, and on one side we have to control the temperature by air conditioning and all the, on the one side it is required, but on the other side this process increases the greenhouse gas emissions, and the hospital is the health facilities are contributing 4.4% to the greenhouse gas emissions, though it is small, but it is at global level. So but it is if we look at this individual, so I think for this is also an area which needs to be looked after, and you rightly mentioned about the private sector. We have huge private sector, and but we are not having trickling down effects on the private in the private sector. So we have invited Dr. Qaid Saeed, who is CEO of Islamabad Health Regulatory Authority. And my question from Dr. Qaid Saeed, or my will be, I would like to have take the comment from him that what about the, you make the standards for the health as a health regulatory authority is making the standards for the hospitals, including the private hospitals. But are your standards including the climate change impacts in that, or are they how the private hospitals are taking with the climate change as such, how they are responding to it? Thank you. Hanji, sir.
Okay. Thank you very much, Dr. Razia, for inviting me. I think we should understand that the health system is composed of several actors or stakeholders. And the biggest one is public sector itself. But then we have very strong private sector, which is increasing with time. And what Dr. Zafar was saying, at least 70% of the population, according to the latest statistics, are actually going to the private sector to seek treatment. So the private sector is now the major player in terms of treating patients, whether they are because of the climate change or otherwise as well. Now, unfortunately, they are not part of the discussions or the planning that is being done or conducted at the federal level or by the government for climate change. But then they are there to respond to increasing number of emergencies or increasing number of patients of different diseases. I would recommend that in future planning processes, all these private sector, major hospitals, and even NGOs that are working in private sector, they should be part of that planning process, because they are going to bear a big brunt of new patients that will emerge because of the climate change that is happening in the country. I think we should understand that where do we, as Pakistan, where do we stand in terms of this climate change? And I went through data, and I found that a study was conducted where they actually assessed 191 countries in the world and tried to assess how vulnerable they are to the climate change. And Pakistan was among the highest vulnerable countries. It's 18th out of 191 countries, which is very, very vulnerable to climate change. And with this climate change, we expect direct and indirect impacts. Direct impacts on health would be the diseases that are going to come up. And the biggest one are actually the vector-borne diseases. And I think we have an expert available, Dr. Mukhtar, who is going to talk about those. But then with that, we have increasing number of zoonotic diseases. And this zoonotic disease is also very important because of the climate change, you would observe that the ecosystem would get disturbed. And when you have ecosystems disturbed, the animal viruses or animal bacteria, they jump into humans. And this happened with COVID-19 actually, where the virus was actually animal virus. It jumped into human viruses by change of reassortment of their genes. They became a virus that infects the humans as well. Now, what we are going to foresee is actually not only the direct impacts, but the indirect impacts through food security issues, through flooding, through heat, agriculture. And I think what needs to be done is not only we involve the private sector and the public sector of health, but this concept of One Health has to be brought into even this area where we want to control the impacts of the climate change. So I would recommend that in future planning processes, not only health, but also all other sectors should be part, and I'm sure they were part of the National Adaptation Plan. But then the private sector and NGOs and all the stakeholders who are part of each system, not only in health, but in education and other sectors, should also be made part of the future planning processes. Back to you, Dr. Razia.
So we have Dr. Mukhtar. He is he's heading the our very important program on malaria and dengue, and he is so he has many publications, and recently he has published on climate impacts of on malaria. And I would like to ask, what about the what is the preparedness of the Pakistan for the coming up the climate related health climate related vector-borne diseases, and also what was the response during the last year floods, and how do you gauge it? Is it very good, or how much we need to do more? So over to you, Dr. Mukhtar.
Thank you very much. Assalamu alaikum. My name is Mohammad Mukhtar. I'm Director, National Malaria and Dengue Control Program. And thank you very much for inviting this very important aspect of the climate change, because as our Dr. Razia and Dr. Fatmi and Dr. Qaida also very rightly mentioned that the climate change has a direct impact on the not only agriculture but mainly the health. And if I talk about within the health, that the vector-borne disease are the most important aspect. And I just give you, before going to detail, I just give you the example of the malaria. In 2021, we have 370,000 malaria cases in Pakistan across the country, 370,000. But after the flood in 2022, we have 3 million cases of malaria. It's a huge jump of the malaria cases in Pakistan. And we were not expecting that the game is over when 22 is crossed, when the game is over. But even in 2023, we are facing the same consequences. And I'll just give you the example of the January. We have in 2022 January, we have only 6,000 cases of malaria in Pakistan. But January 2023, we have 124,000 malaria cases. Actually, January is a malaria-free month in Pakistan, but just because of these climatic change and then the floods, we have the hundreds of thousands of malaria cases. And the same is case with the dengue. When this climate change start talking about the climate change and its impact on vector-borne disease, we analyze the data of last 100 years data, the temperature, rainfall, and the vector-borne disease incidence. And we found that in case of dengue, I have given you the example of the malaria, but in case of the dengue as well, our all indicators, number of cases, number of mosquito generation, number of breeding sites, almost 3 times increased last 10 years, which means that again, the dengue is also. So these two are the major diseases which we are currently facing. During this flood, definitely it was a new incidence in Pakistan that the flood was, though we have also faced the flood in 2010, but its magnitude was almost similar, but the area was different. This time we are mainly facing in the Sindh and Balochistan, which is already malaria and dengue affected. But that's why the program, honestly speaking, was not fully prepared. But thanks to partners, the government of Pakistan, they jumped in very quickly, responded very well, and we distributed, during the flood, we distributed almost 6 million bed net to affected communities. And because the bed net is not a very magic bullet during these floods. Then we jumped to fund another intervention, that is spraying. Because you know that after the flood, the people were living in the temporary shelters, in the tents and the schools or temporary buildings, where we can't use the bed net. Though we have distributed 6 million bed net, but those bed net are not being used by the community just because of certain many issues. Then we jumped, the government of Pakistan and the partners started giving the spraying for these temporary shelters, which was very effective. But unfortunately, there are some gaps were identified by the program, that we have given the huge support to the affected communities, but still there's a lot thing to do. But thanks to the partner and government of Pakistan, honestly speaking, the response was very good. Though there is a lot of things to do, more in need of the improvement, but the response was there. And as a response, we analyzing the data. If response not there, and what is the response? The number of cases almost doubled. It may be just 6 million, but we were up to 3 million. So the response was there, but still there is need to do a lot, particularly to control the dengue and malaria in Pakistan. I think this is covered, and if you have any point, we will discuss it openly.
Okay, thank you, Dr. Mukhtar. So I think that is great that we could respond, but still, as I said, that we are following the responsive adaptation. What about the anticipatory adaptation? Do you have any plans in your malaria control program, which are anticipatory, and we can like 6 million, jumping from 300,000 to 6 million, it is huge. So how could you manage that?
Yeah, I missed this point. Yes, we have, when this incident was there last year, and the government asked to have some regulatory plan. Sorry, thank you. And we prepared our 5-year plan for the control of the malaria dengue in Pakistan, and particularly we especially focused the emergency and control of the malaria dengue under humanitarian emergencies, because it was a big humanitarian emergency in the country. So we prepared the 5-year plan. It is a costed plan approved by the provinces, all the partners, and the partners are there to give us the support. And this year we also have the plan to distribute another 6 million beds, 6.2 million bed nets, particularly the Sindh and Balochistan, which are mainly hit by the flood. And the same, we are also have a very big plan for the spraying of the shelter places, not only shelter places, but the houses which are there, not damaged due to the flood. So the program has a very good plan as a response. And though it's not 100% response to all the affected communities, but at least we have a 5-year plan, and mainly focusing if God forbid, if there is another similar situation in the country, where to respond. So plan is there, 5-year plan is there, and provinces are on board. Not only provinces, but all the partners are on board. But there are some partners like WHO, UNICEF. They have given a huge support to the program, and they are also committed for the 2023, and then the support is there. So plan is there, the preparation is there. So program has a very good preparation. If there is similar situation, the program is ready to cope this situation.
So now our next esteemed panelist, Dr. Our Deputy Executive Director, SDPI, and he's heading the Climate Resilient Program at SDPI. So I would like to ask him, like, according to the PDNA report, like the loss or the health system required 40 billion rupees to respond to the impacts of the floods last year. So how do you think that, how is and recently you have done the paper on climate financing also. So how bigger part of how much is the health being allocated on that? So can you please tell us more about health financing for climate change?
Thank you, Dr. Razia. And I would like to thank on behalf of SDPI, Dr. Mukhtar Saab, Dr. Qaid Saab, or Dr. Zafar Saab online. I think they have given us a pretty good overview of what is going on in health sector and how it is damaged and how in climate is impacting our health system. And particularly when we talk about resilience, is that are we preparing well for the future? Because climate change is not going easily or as early as anyone can think. It is going for long. So now there are two ways. One is the mitigation. The other is adaptation. First, I will respond on the finance side. Then I will come a couple of other points which I want to share so that it should be a sharing of experience, because I am not a medical doctor. I am another side of doctors. So that's why I just want to clear it. Well, one is mitigation, that we do something which contribute to elimination of the greenhouse gases. First part is the mitigation. When we talk about finance for mitigation, because it is a brick and mortar model type thing, so many banks can give you finance. Always challenges for adaptation, banking project for adaptation. In our paper also, we have seen a lot of things where, we have suggested that we should not only vie for the international funding, which is difficult to access. And that is hardly, in a position to access because of the technicalities. Number one is that we have to prove them how it is linked to climate change. Everybody knows that, particularly in the context of 2022 floods, which is not a normal northern riverian flood. It was a south-generated weather system that caused this flood. And that's why Dr. mentioned a lot of more malaria cases, because water was stagnant for many months. So that's a new situation, which is because of the climate change. And last year in COP27, I was also there, and Pakistan made a case. The whole leadership, including the Prime Minister, Foreign Minister, the Environment Minister, they were lobbying for like anything, G77 plus China. We were in a position to pitch our case, and we actually pushed our case, and we got the loss and damage fund established. But that's not enough. Now, where from setting up a fund, we move to onwards. Fund is already there, GCF is there, GF is there, two facilities are there, but they're hardly to access. Now is the loss and damage thing. Again, I am not hopeful that loss and damage fund would be soon operationalized in the COP28 when we are going to Dubai. So that's not going to help us things. But what help us in terms of finance is that we have to negotiate. For example, public and private sector, health systems, they should develop a work plan, a proposal which is bankable, and there is finance available for the banks, commercial banks, with the mediatories. For example, there is NDRMF, National Disaster Risk Management Fund. It is not a bank, it's a mediatory. It gets funds or the finance from other sources, and 30% you can contribute, 70% they provide you. So for example, public and private sector, if they want funding to build the resilience of the existing systems in health, which we have seen that they are destroyed and they are still at risk of being destroyed in the next flood or in any next emergency like COVID. You have said that, you know, this system generates everything. And Dr. Zafar mentioned particularly about that you are on the at the front line to respond to any emergency, which is true. If it is earthquake, we have seen in 2005, many cases of paraplegia was over-reported. And many people, the life was destroyed. And because we did not have that much expertise at that time to rescue in a way, because, you know, somebody's in the rubble and how to pick them up. So these kind of things we have to build in our system. So one financing we can take, which is difficult to my study and understanding, mitigation projects are largely bankable. Bank ko pata hai ki ye project lagega, that much people will be beneficiaries, or iske ye asrat honge, so we can do it. For example, agar we say that, you know, we want to reduce green gas emissions, so we can have a project. Even you mentioned, Dr. Sabha, that 4.44% of the gases are generated from the health system. And that ratio, if we applied in Pakistan also, whatever meager source or the share we have in the global GFC gases concern, so with the same scale, we might have the 4.4% of what we are generating. So there is a carbon footprint within the system. If we are investing, we want finance, that we want to modernize our health system, make it resilient and less carbon consumption in it. Carbon footprint we have reduced, then certainly we need financing. We need to build such sort of a project. Private and public sector both can do. Private sector has the financing. They should come forward and they should spend in there instead of just putting in, you know, some sort of private hospital. They should, you know, invest in the system, not just in the health business. Whatever we are having, it is in investing in health business and earning. Earning is not bad out of a, you know, of course, this is a business also, but at least it has a system-based work, which is part of the overall ecosystem. So that's why financing, one source is the home ground sources can be tapped, and they are the banks. Banks have the money, but we have to come with the right thing. Even 4 of our banks now have the international accreditation also with the GCF. They can be mediatory for us to get finances. If, for example, your academy or your institute, if you're interested to support some of the hospitals or some of the system to be improved and made resilience, then these bank, JS Bank, Habib Bank, and there are other facilities, those who are accredited with the Global Fund now. So they can be mediatory for us. So we can approach through them. This is the second option. The third is that we should give bankable projects in this field, for particularly adaptation. I am not talking much about, you know, mitigation, because mitigation has a different thing. I'll come on that later on. So adaptation is number one thing, because otherwise we cannot compete with the current challenges. So these are some of the things which I want to highlight on the finance side. Let me move on the other side. For example, waterborne diseases. Water is also becoming a big issue. But I would say here that whatever I have read is that, or studied, 80% of the climatic issues are related to water, be it Indus or groundwater or any sort of water. Either water is overflown and we are flooded, or water is short, we are facing droughts, or water is contaminated, we are having diseases. So all the three fronts are impacted because of the water. So we should focus on the water thing. Second one, the diseases you all have talked about largely relate about the air pollution. That's a big, elephant in the room. We have to look at that. On that, I have a point which I want to share with you, which is the fossil fuels. Fossil fuel burning is the major cause which actually pollute our air, which is causing diseases in the urban cities. Once, I was in Delhi and I could not breathe. After a few years when I was there in Delhi, so they improved their transport system, replacing with fossil fuel with the green fuels. And then I could open my eyes in that environment. So why we cannot do this? The fossil fuel is the big problem with the health. It has multiple things, diseases you have talked about. I just want to focus on that. SDPI is working on fossil fuel phase out campaign. We got it, recommended or got it approved by some of the parliamentarians. They endorsed our call that fossil fuel should be phased out. Of course, immediately we cannot phase out. We cannot stop, but we can start reducing. I would quote here the example. Last month I was in Colombo, Sri Lanka. Many years before I was posted there, and when I was last month there, I had felt a marked difference. At that time there was too many cars, too many traffic, you cannot pass. But now when I ask where are the cars, where are the people, they say because of the economic things, cars are parked at homes. Only 30% transport is working. Which means 70% fossil fuel gone from the roads. And that phase out was because of their economic situation. But why not we can make it an habit that we should burn less fossil fuels? Why we are not doing carpooling? Why we are not adopting other things? So ultimately, somehow, when we are talking about health system, ecosystem, health system resilience, it is not just getting more hospital, getting more facilities done, more facilities saved against the disasters. It is that we have to go to the mitigation side also. Less carbon production, carbon footprint, and that could be possible through phasing out the fossil fuel. This campaign is on. Since you are senior official, you are sitting in a responsible position. Somewhere where you sit in the meeting, you can also raise this issue, and you are scholars also in your own study and your own research. You all are scholars, so you can put into your papers that somewhere in the health sector we have to talk about the phase out of the fossil fuel, and that's a part of the every citizen's part. And that's why if you look at the adaptation plan, national adaptation plan talks about that it is everyone's responsibility to be adapted, to contribute to adaptation. It is not just government or one institution. It's a collective responsibility of people of Pakistan that we adapt to this situation, because this situation is not going anywhere. We have to face it. That is the reality. And amid this reality, I think we should learn that at least fossil fuel phase out could be one of the solutions which can lead us towards better mitigation. And on adaptation, I have requested that we all should, particularly from the government side, they should come the bankable project so that we can generate funding locally. So international funding is going to have difficulties. That's my stake. Otherwise, if you have more questions, you're welcome.
Yeah, so I think thank you very much, Dr. Shafkat. I think it's like in the recent meeting at the high level meeting at New York, General Assembly meeting, it is said that or otherwise it is said many times that the investing in health, spending on health is not a cost, it's an investment. Like it's ultimately will come back with the improved health of the people and with reduce the cost. So I think that is very true, that the mitigation side is also very important. And mitigation, like the greening of the health facility is the one of the mitigational initiatives. And Pakistan started off, I think, in KPK, some facilities were green, started off with for the greening. But I don't know about that. What is the situation now? If our DG was health was here, so we could ask him. So I think this is one of the things that the greening of the health facilities will reduce the greenhouse gas emissions and the impact of the climate change also. And now I will come back to Dr. Zafar. Dr. Zafar, you are the part of the biggest hospital in Karachi or in Pakistan, like Aga Khan University Hospital, which is JCI accredited, and they have their standards as well as they are like very modern, or they respond to the requirements. So how do you think that they are responding to this climate change impact, or how they are making their system more resilient, as well as reducing the greenhouse gas emissions, or reduce on this in this mitigation side? And also the what is the human resource status there? Are they very much aware of the climate change impacts, or are they being given, like when I was working there, so there used to be some training sessions in the morning, like every new thing, like you were given lectures and everything. How are those institutional capacities of the Aga Khan or the private sector, which are improving, which are highlighting the climate change impacts? Thank you.
So, thank you, Dr. Razia and colleagues. So I thought that you, I mean, I raised my hand to say exactly something in the same line, and when you came back to me, thank you for coming back. So one thing, I want to highlight two things. One thing which Aga Khan Development Network, including the Aga Khan University, is doing, they have set a goal called Net Zero 2030. So now this, when you talked about this 4 to 6%, or even some of the systems are generating more of the greenhouse gases. So Aga Khan Development Network across the campuses, they have set that goal that by 2030, they will bring down their emission to zero. And for that, what they're doing, you know, they're taking several steps. So can you imagine what is the major greenhouse gas emission component in the hospital? It's the supply chain. So there's a lot of things which are coming in the hospitals and going out of the hospital. So every bed produces, for example, you know, a few kgs of, you know, waste, which is coming in the hospital every day. And so that's where we can make a dent. And also some of the smaller medicines, for example, asthma inhalers. So there are different kind of inhalers, and these inhalers produce, you know, greenhouse gases. So these inhalers produce, although these are very small devices, they produce a very large quantity of greenhouse gas. Those inhalers, the alternative inhalers are available, and those inhalers can, you know, can be utilized, and the pharmaceuticals needs to be advised on that. And so the supply chain, the hospitals like Aga Khan University and big hospitals and PIMS and other hospitals can actually influence the supply chain. They're producers. So there are 10 other companies, 20 other companies, including pharmaceutical companies, who could actually adapt this net zero emission thing. So what we are trying to do, we are doing like avoiding single-use plastics and other initiatives we are doing within the hospital. We are trying to convince our pharmaceuticals to produce some inhalers, which is more environmental friendly and climate friendly. So we will buy only those inhalers which will be, so we can, as a big hospital, can influence a larger community of producers and consumers at the same time. So that's what we have. The challenge is increasing heat and then the sustainability of the building, and then you have these air conditioners going on. How do we transition from an air-conditioned building to a more green building, which is a longer term, goal. So that's where we have a challenge, but we have taken that challenge. Aga Khan University is leading that. So hopefully we will be able to, do that. So one thing which, I was looking at the WHO framework of health system, and colleagues have talked about of the supplies, increasing the supplies, for example, bed nets and everything else, which is great. We should have vaccines and everything else. But that's where a lot of focus has been, and which is good. But there are other components like the female doctors become unavailable during floods, for example. And you have like basic essential services get disrupted because we haven't mapped our healthcare systems, that which of the health facility will be underwater and which will be non-functional. So these kind of vulnerability assessment, which is a simple thing, we haven't done, so that we know an alternative plan should be developed already in place, because we will have floods every other year. We are having floods every other year. So why not have just a map that, these 20% of the health facility will be non-functional, and then the adjacent health facility will be functional, and how do we coordinate that? So I think those plans, besides, just to connect with this net zero plan, the net zero plan, if it functions, if it works by now 2030, it will only be possible if the senior leadership is committed. And the senior leadership, so this plan is coming from the senior leadership, the governance part, which I'm talking about. So the senior or the major hospitals should take the lead and become the champions of net zero, in order for the other hospitals and the smaller hospitals to follow. And that's where we need leadership and governance from major hospitals and major players, whether in public sector or private sector, to play that role. I think without these, health workforce, service delivery, and one more important thing is the information system. We forget all the time, because when the dengue is increasing, so we need to be alerted. When the malaria is increasing, we need to be alerted a little, before. When other diseases are increasing, we need to be alerted as a little more, so the information system becomes as essential in the adaptation plan, or very essential in the adaptation plan. We shouldn't forget those elements. So it's a systems improvement, it's strengthening, and overall, it's nothing new. So it's about supply chain. It's about having more supplies, but it's about human resource availability. It's about basic essential services functioning during disasters, and it's about information system, and it's about leadership and governance. So it remains the same, more or less, which we have to work on. Yeah, over to you, Dr. Razia.
Okay, thank you, Dr. Zafar. I think you rightly mentioned about the information system, and the early warning system is, I think, the most important component of that. Whenever there is So if it's timely in communicated, then we can give the response properly. So that's fine. And you must be remembering that when we were at Ministry of Health and we did this co-benefit study on carbon prints and fossil fuel subsidy reduction in fossil fuel subsidies, and that also which we concluded that if we start reducing the fossil fuel carbon footprint or fossil fuels reduction, so it can improve our heating, like the rate of the heating of the environment will be reduced towards, and we I think documented in the country profile as well. So I think this is very important. And with this I would like to ask but like we are talking about these early warning system and all, but what about the private sector? The data of the private sector is not very much very frequently communicated, unless it is like, for example, during COVID-19 it was shared. But what about the other diseases? Like, are we having some system that we can involve them also in this mitigation process, as well as in the data sharing system? Over to you.
Thank you very much. I think we in Pakistan have the biggest problem that our surveillance system is in infancy. It's not functional in most of the places. And this is very important when we talk about the private sector. Actually, if you go and look at the private sector, their own information system, they have excellent information system available with them. They all have MIS systems. It's all linked to their central computers, and all the information is available. The only problem is that this information is not coming to the central databases. Now, what we have done is that we have worked with the private sector in diseases like dengue. So in dengue in Islamabad particularly, all the information from the private sector, whether they are hospitals or laboratories, are uploaded into a government platform, information platform on daily basis. So this information is coming at the moment. The point is that if we want to involve the private sector in getting the required information or the important information, they are ready to give that information. We haven't built our systems, our own systems, and we have never requested the private sector to feed their information into the systems. We as regulators, whether this is Islamabad Health Regulatory Authority or the healthcare commissions in the provinces, they can work with the private sector, they can push the private sector to feed this information into a central database, which is not there at the moment. So I would urge the government and the responsible officers at the federal level and in the provinces that they should now strengthen their information system, where all the data, whatever they are, the data that is required, can very easily feed into the system, because they have excellent MIS systems functioning in their hospitals. Thank you.
I would, as a small question from Dr. Mukhtar, sir, that you mentioned about your 5-year plan about the malaria and dengue. So what is your surveillance system, and is it very effective, or is it has it involved I understand that the private system, what about at the district level? Are they responding to your the private hospitals or clinics are responding, giving you the data, or what is the situation there?
Thank you, Dr. Razia. This is the major challenge of the, not only for malaria, for all the health sectors. The data sharing from the particular and the private sectors has always been a very challenging. But in the program, in the National Malaria Control Program, over the last few years, we are involving the private sector intensively. We have given some incentive to the private sector that they can share the data to the government, so that, because until unless we don't have the data from the private sector, as you know that almost 70% from our side malaria cases are being treated by the private sector, and the data has not been properly shared. But over the last few years, not few years, but I can say 2 or 3 years, we are giving some incentive. We are involving the private sector. They can share the data with us. Though the challenge is there, but the program is struggling hard to get the data from the private sector. I just give you the example of one of the districts, Zob, which is one of the most malaria affected district in Pakistan. We have started the public-private partnership. We have established some microscopy center in the private sector so that they can give us the data, and that is the exemplary district for us. And based on our findings from the Zob district, we are ruling out. We are expanding our public-private partnership with the private sector in other districts, particularly in the Sindh province after this flood. Other things which the program has made a development, though we are not getting the desired results which we are expecting, that we have shifted all our malaria information system on DHIS2 system. Now all the data of the malaria is available online, and this is one of the good example that the flood was the rain start in the end of the May last year. End of the May, we reached to the state of emergency of malaria in the end of the August. So during the August, we were at the state of emergency with respect to malaria cases in Pakistan. But our system, health malaria information, MIS or DHIS2, detected this outbreak during the first week of the August, which is actually the beauty of the system, that they detected that something is wrong in Pakistan and something is going to be more worse. And with the help of WHO, we detected that outbreak and we started the preparation. Honestly speaking, we should not underestimate ourselves. Sometimes our system is working very properly. And that's why, and malaria is an example. Last year, malaria was an example that we detected these outbreak first week of August, and we reached to the state of emergency end of the August. So the system was there. And that's why using that example, we are further strengthening the system in Pakistan. And hopefully within a couple of years, we will be in a strong enough that we can detect if, God forbid, a similar situation is going to happen, and the program will be in position to detect the certain things well before time. Regarding the 5-year plan, definitely 5-year plan was prepared on the basis of the lesson. Otherwise, our previous 5-year plan, which was started in 2020 to 24, we have to revise in 2023. Why? Because of these lessons learned which we learned from the flood 2022. That's why we revised our national plan of action, 5-year plan of action. And in that plan of action, we included a very comprehensive chapter on the climate change. What is climate? What will be its impact in future? And how the program can respond if the similar situation will happen. So data surveillance system is one of the key area which we are going to make some improvement. Thank you.
Thank you, Dr. Mukhtar. Congratulations on making this 5-year plan, and thank you very much. And I think it can be shared with the audience or with us also. And now one of the climate impact on the health facilities is the wash sector, which is very, very important, and which is very like one of the major 4 sectors which are affected by the climate change during any climate event. We have Mr. Irfan Durrani. He's a wash expert from UNICEF, and he has worked in Pakistan as well as in Sudan, I think. So we will have a comment from him regarding the flood situation, and he was very active during this phase, during even COVID-19 also. So your comment, please. Thank you.
Thank you so much, Dr. Razia Safdar Saiba, and thanks for inviting to this important meeting. Actually, you rightly mentioned, we have talked about like the preventive side of the health, and unfortunately, that is something which is ignored. And we are really going to the curative part, like trying to sort out the issues which are happening. Especially like we see that in flood, we see that in case of cholera, we see that in case of typhoid, which is happening in Karachi nowadays. But we know we have this 15,000 health facilities, public sector health facilities, and somehow we don't have any information that we regularly do not see how many health facilities of ours are DRR compliant. I mean, the structures are there. We see different issues. In 50% of the health facilities in Balochistan, they don't have water. So it's a water scarce. If you look at Sindh, you have most of the health facilities which have saline water. So they don't have any water for drinking purpose. Now, if you come to Punjab and you come to KP, there is water which is contaminated. Nobody is looking at the water quality part. It's hardly like the scoping study that we did. It was saying that only 3% of the health facilities see whether there is a water, the water which is we are giving to in the health hospitals or in the health facilities, is it drinkable or not? So the issues are very grave. I think we should everybody of us should look into the climate change very seriously. Every action that we do, it has an impact on the environment, and it backfires in so many manners. We have seen Razia Safdar Sahiba has given us an example of we do the air conditioning, but we don't know how much it producing heat, which is increasing the temperature on the ground. And we are not going for the sustainable solutions. So I think let's on ourselves, everybody of us, as you rightly mentioned, that everybody of us should be the champion on it. And we need to look our issues more actively into, if we have more money, we know we have big cars, everybody like to have big car. Think of if a company saying that, okay, this is a new car, so in Pakistan, everybody will buy those cars. They don't look at that, whether should I use this car? Is it my requirement, or is it something with that? So you are creating those a chain of impacts. And I think we should break that chain by looking at ourselves, doing the energy audit for ourselves, doing the energy audit for our organizations. How many organizations do we see do that? Nobody do it. So if we start doing it now, then I think in the long term, we can reach a point that we can think that, yes, let's minimize. Yes, we have worked on it and we have achieved 2030 targets. But unfortunately, with the attitude, if we have, we will not be able to do it. So I think everybody of us sitting here should be the champion of it. Everybody should think of reducing the carbon footprints. Everybody should think of whatever actions that I'm doing, whether it's a solid waste creation, whether it's the water usage creation, water usage, wastewater which is going into the out of your house, how to tackle that, how to work better on it so it has less impact. Thank you.
Thank you, Irfan. Now the floor is open for any questions you can put to the panelists, please. Yeah, please.
Yes, thank you very much for this, very, deep and, wide-ranging discussion on climate change. I have, two questions basically. Yes, my first question is to, Dr. Saab about, climate finance. Because, climate finance, accessing climate finance is a very specialized area. And health professionals being very busy. And they are not, grant savvy or others. And I think this problem was highlighted in another, big report as well, WHO report. So my question to you is how to overcome this hurdle. And my, related question is that, climate finance is becoming more of private initiatives. And as I understand from previous, climate, in conferences, even, Kerry at the last conference said that, the government finance will be less and less, available. And in a country like Pakistan, where it is hard to make case for, climate change. Yes, do you think, banks would be interested in, funding? And what is the take? And second question, Dr. Saab, to you. These, in climate,
Happen, how we can detect in advance. If there is something, how to respond. So capacity building of the program at our level is one of the key area of the 5-year plan of action.
this is in relation to climate change.
Yes, yes. Okay. Because the new 5-year plan has been developed primarily based on our experience of the 2020 plan.
Okay, any other question?
I was just commenting on Dr. Saab, response to that. So far, unfortunately, where we talk about different like a health facility. In a health facility, okay, what you want to be a bankable project? So we need to identify what are those areas which can be bankable, and private sector can contribute to that. And what are the things which are not bankable and which the government has to spend their own resources. So we need to bifurcate that. If you do that bifurcation, then it will like open up an avenue for private sector to contribute. And I think there is always a niche for that, because the private sector comes to the business when they see some models. Like solarization is one example. We have seen that even you also mentioned about the private sectors, they're coming into this, but we know government spends a lot of money on electricity bills and stuff. So even we were doing one project for KP, one DHQ, and do you would just mean the July bills, utility bill for electricity? Can you imagine how much it could be? Like 1 million, 2 million? No, it's 7.5 million Pak rupees for a hospital. So imagine the amount of resources that we spend, and they go as like your carbon footprints directly. It's effective. So if we could work on the projects which are like do the solarization of it, it's a sustainable. You have got a sustainable electricity in a hospital for 25 years with that investment. So it has its very long-term impact, both in terms of cost saving for the government and also for the environment. So maybe we should look into such projects and look into different components of our, just like you mentioned about the solid waste. One part of it is solid waste, which is being collected. So can we have something on this as a public-private partnership, which is a bankable? So think of the others, other components as well. So that's my humble request that whenever we do planning.
Just add to what Irfan has said, just for the information, why private sector should pay? There is a question. The answer is that private sector is responsible because they are the polluters. So under that rule, they have to complete ESG, environmental compliance, social compliance, and governance compliance. In that count, they have to pay money for the reparations. So that's why banks are there. That's why private sector is there. Even PepsiCo and
Record नहीं होगा.
मेरा नाम मोहम्मद वकार भट्टी है और मैं एक हेल्थ जर्नलिस्ट हूँ, दी न्यूज़ से वाबस्ता हूँ. बहुत अच्छा होता कि अगर हमारे डीजी हेल्थ साहब मौजूद होते तो कुछ बातों का जवाब वो दे सकते, क्योंकि हम कायद साहब रेगुलेटर हैं और डायरेक्टर मलेरिया प्रोग्राम है, लेकिन मिनिस्ट्री से अगर कोई शख्स होता तो डेटा की सर बात हो रही है. वैसे तो क्लाइमेट चेंज के इम्पैक्ट्स बहुत ज़्यादा हैं, इफेक्ट्स बहुत ज़्यादा हैं ऑन हेल्थ सिस्टम एंड हेल्थ, लेकिन मैं दो चीज़ों की तरफ इशारा करना चाह रहा हूँ. एक है वाटरबॉर्न डिजीजेस और दूसरा है वेक्टरबॉर्न डिजीजेस. अब प्रॉब्लम ये है कि क्रिमिनली डेटा इज बीइंग हिडन बाय द अथॉरिटीज फ्रॉम द पीपल. मिसाल के तौर पे इससे क्या फ़र्क पड़ता है कि अगर पिछले साल या 21 में 6000 मलेरिया के केसेस थे और अब 6 मिलियन हो गए, लेकिन अगर आप ये नहीं बताते कि अगर एक डेथ हुई है उस 2021 में और 2023 में उससे 600 डेथ्स हुई हैं, तो आप क्या मैसेज देना चाह रहे हैं लोगों को कि अगर 6 मिलियन भी हो जाएंगे तो कोई फर्क नहीं पड़ता, और 600 थे तो भी कोई फर्क नहीं पड़ता. तो यू आर नॉट एजुकेटिंग मासेस, यू आर नॉट लेटिंग अस डू अवर जॉब टू एजुकेट. एक बात तो ये क्रिमिनल जो एटीट्यूड है इन हाइडिंग डेटा. कायद साहब मेरी बात समझ रहे हैं कि मैं क्या कहना चाह रहा हूँ, कि जो आप डाटा कंट्रोल करके आप डिजीज कंट्रोल करते हैं, फिर आप लोगों को नहीं बताते. सेकेंडली, वाटरबॉर्न डिजीजेस. हर हफ्ते 2.5 लाख केसेस वाटरबॉर्न डिजीजेस के रिपोर्ट हो रहे हैं, फॉल्टी सिस्टम के बावजूद. तो फॉल्टी सिस्टम जो है वो आपको बता रहा है कि 2.5 लाख केसेस हैं, और नीचे लिखा होता है कि दिस कुड बी 3 to 4 टाइम्स. तो लेट्स से कि 5 लाख केसेस हैं वाटरबॉर्न डिजीजेस के. WHO कह रहा है कि दुनिया के 33 ममालिक में कॉलरा ने तबाही मचा दी है इस साल ड्यू टू क्लाइमेट चेंज, और आपकी गवर्नमेंट ये कहती है कि नहीं जी, नो कॉलरा, देयर इज नो कॉलरा एट ऑल. ये सब बकवास है, और जी हमारे यहाँ तो ये होता ही नहीं है. तो ये जो आपका क्रिमिनल एटीट्यूड है टुवर्ड्स हमारी अथॉरिटीज का, टुवर्ड्स हाइडिंग द डेटा, हाइडिंग द डिजीज, हाइडिंग द इफेक्ट्स ऑफ द क्लाइमेट चेंज, ये हमें असल मार रहा है. वी नीड टू एड्रेस दैट, वी नीड टू टेल देम दैट. आखिरी जुमला के सर ने कहा कि प्राइवेट सेक्टर नहीं देता डेटा. मैंने पिछले साल 10 प्राइवेट हॉस्पिटल से पूछा कि डेंगू डेथ्स कितनी है. एवरीबडी टोल्ड मी. आगा खान ने कहा 40 हैं, जहुद्दीन ने कहा दोनों अस्पतालों में मिला के इतनी है, शिफा ने कहा इतनी है. तो 10 अस्पतालों का डेटा मैंने लिया तो पता चला जी 300 डेथ्स थी. और ये किसने बताया? इन्फेक्शियस डिजीजेस डिपार्टमेंट्स ने. मैंने रिपोर्टेड दैट. तो गवर्नमेंट कहती है नहीं जी आप बकवास कर रहे हैं, ऐसा हो ही नहीं सकता, हमारे पास तो सिर्फ 40 डेथ्स हैं. तो ये जो क्रिमिनल एटीट्यूड ऑफ हाइडिंग द डिजीज, हाइडिंग द मोर्टेलिटी इज द रूट कॉज. एंड इसके ऊपर जो है ये हमें बताना चाहिए लोगों को, और इनको बताना चाहिए कि आप इस तरह करके हमारा बेड़ा गर्क कर रहे हैं. पूरी दुनिया कुछ कह रही है, WHO कुछ कह रहा है, यूनिसेफ कुछ कह रहा है, और आप जो है हमें इस तरह जो है वो लॉलीपॉप देके हमें रोक के बैठे हुए. थैंक यू वेरी मच.
Thank you, Waqar Sahab. Your point is taken seriously, and I think आप कुछ कहना चाह रहे हैं?
थोड़ा इसको रिस्पॉन्ड करूंगा मैं, अगर आप
अच्छा,
इजाजत दें मुझे. बड़ी साहब थैंक यू, बहुत इम्पोर्टेंट पॉइंट है. लेकिन हमें एक और चीज भी समझनी चाहिए कि कभी कभार कुछ डेटा इम्पैक्ट कर रहा होता है दूसरी चीजों के ऊपर. और मैं सबसे इम्पोर्टेंट मिसाल दूंगा, ट्रेड. पाकिस्तान की जो एक्सपोर्ट्स है, और मैं खाने की एक्सपोर्ट्स की बात कर रहा हूँ, मीट हो गया और बाकी चीजें, डेयरी प्रोडक्ट्स हो गई, अगर आप एक्सपोर्ट कर रहे हैं और अगर आप डिक्लेयर करें कि कॉलरा जो है आपके मुल्क में प्रेवलेंट है, तो जो आपके बायर्स हैं, खासकर यूरोपियन कंट्रीज वगैरह, वो किसी सूरत में आपसे लेने के लिए तैयार नहीं. अगर आपने अभी सुना हो तो UAE ने पाकिस्तान से गोश्त जो लेते थे उसको बैन किया हुआ है. अभी उस प्रोसेस को दोबारा से रिवाइज कर रहे हैं, आपने अभी अखबार में पढ़ा होगा. तो ये जो इम्पैक्ट्स होते हैं डेटा के, ये भी हमें अपने जहन में रखना चाहिए कि अगर गवर्नमेंट कुछ चीजों को नहीं प्रोजेक्ट कर रही तो उसके पीछे भी कोई वजह है. हम पहले ही कैश ट्रैप्ड हैं, हम पहले ही इकोनॉमी हमारी जो है वो कहते हैं टेंट्रम्स में है. तो अगर आप डिक्लेयर कर दें कि ये इन्फेक्शंस भी अवेलेबल हैं, तो जो थोड़ा बहुत एक्सपोर्ट कर रहे हैं वो भी रह जाएगा. तो इसका ये इम्पैक्ट है. लेकिन ऑन द अदर हैंड आपकी बात से मैं 100% एग्री करता हूँ कि वी शुड हैव अ पॉलिसी ऑफ ग्लासनोस्ट, जो रशिया में गोर्बाचोव ने दी थी, कि हर चीज को ओपन रखो, लोगों को बताओ कि क्या सूरत हाल है, ताकि लोग प्रिपेयर हो सकें और रिस्पॉन्ड कर सकें. चाहे वो इन्फेक्शन आ रही हैं, चाहे वो डिजास्टर्स आ रहे हैं, या फ्यूचर में कोई और चीज आने वाली है, लोगों को पता लगना चाहिए. लेकिन गवर्नमेंट की मजबूरियां भी हमें अपने जहन में रखनी चाहिए.
सर वो एक्सपोर्ट्स का तो अपनी जगह पे है, लेकिन मसला ये है, एक तो लोगों को नहीं पता चल रहा, दूसरी बात ये कि वो जो अथॉरिटीज हैं who have to take action, who have to, मतलब वो भी सुनमुन बुकमुन हो जाते हैं ना. they do nothing and they look busy. वो कॉन्फ्रेंसेस में जाते हैं, वो बड़ी बड़ी बातें करते हैं, वो बड़े बड़े हमें भाषण देते हैं, बट दे डू नथिंग, क्योंकि डिजीज ही नहीं है. एंड सेकेंडली लोगों को पता नहीं है और वो मर रहे हैं, और उनके लिए कोई आपके पास कोई रेमेडीज ही नहीं है. तो 2 इश्यूज हैं. ठीक है, थोड़ी सी एक्सपोर्ट रुक जाएगी, लेकिन आप प्रॉब्लम को आइडेंटिफाई तो करते हैं, एक्सेप्ट तो करते हैं, और मिटिगेटिव मेजर्स तो लेते हैं आप.
Actually, हमारा जो health system है, it's a very complex and it depends on many factors. और social जो है determinants हैं जो वो बहुत ज़्यादा हैं इसमें. So thank you very much. I would we are at the end, and I would thank you, Dr. Zafar Fatmi, for being with us. Thank you very much. And Dr. Shafkat and Dr. Mukhtar and Dr. Qaid Saeed Saab. Thank you very much for participating. And I think for the next time, we will take more questions. Thank you very much. Thank you.
Thank you, everyone. Thank you.
Ji, I believe you people are hearing me. Assalamu alaikum to everyone. My name is Dr. Haris and I am from Shifat Amir Millet University. I'm an academician basically, and I teach marketing. So social marketing is my domain. Social marketing is all about behavioral change of the people. And when I have gone through with this discussion, I come to know that I believe that one of the most important stakeholder, that customer is unaware of the problems. This is very vital. We need to create such awareness in the community that a normal person can understand these concepts. Because he talked about the flood, they're not ready, though they know that they have the poor houses, the poor constructions. What my question is that we people on the literary grounds discuss so many things, but how we can create the awareness among a layman. He's sitting from the United Nations, or there are so many people, you people are from health domain, but people of Pakistan are unaware of their severity and problems. How we are going to create the awareness, though we see the commercialization advertisement, we see many things, but people are very much unaware, and this creates the careless attitude. And so somehow some of the plans executed well, but they relapse, they collapse. How the behavioral change will get implemented? My simple question.
I think health में तो behavior change communication
बिल्कुल हाँ, that is point. I think today's topic is climate change and health systems. So that's why I think your point is good. And on a very lighter note, our media is making people very much aware of the mehengai and all. Everywhere is like the life is not running. So things are good in Pakistan, not very bad, but still we need to improve them. And our health system is very, very like especially the public health system is very, very like resource poor, but still we are like the health system is doing well. And there are new approaches also coming up, and the private sector is holding a lot. And the philanthropy in the private sector, philanthropy is also very large contribution. Thank you very much all. And your point is very well taken. Next time, whenever I do, I will take it on account, and I will invite you. Thank you. Thank you very much.